Hello everyone, so today we're going to talk about reproduction and mothering. And some of these are controversial topics, some of these are topics that may be difficult for some of you if you have experience with them. But it's really important to talk about because obviously this is one of the things that only people with uteruses can do, right, in terms of reproduction. So it's really important to talk about. So the reproductive justice movement is a feminist movement centering around 4 basic rights. So to have kids or not to have kids, to parent one's children in a safe, healthy environment, and then to express one's sexual and gender identity free from oppression and fear. And I think it's really important to look at this definition because a lot of people, when they hear reproductive justice, only think of abortion. But there's a lot more to it. So for example, for certain minorities like Native American women, in the past Black women, people with developmental disabilities, there have been times in the past where they have been involuntarily sterilized. So they would go in for a procedure, not know what it was, and come out and their tubes would be tied, or they'd been given a hysterectomy. And that's, again, without their consent. So I think it's really important to think about that as well, that this is also about your right to have children, right? Stratified reproduction is the unequal situation and where there are more resources based on factors such as class, race, ethnicity, migration status, and have greater autonomy and choice with regard to their ability to have and raise children. So basically, women who are middle class or upper class have more freedom in terms of being able to access proper family planning and birth control, as well as often being less judged for their choices related to children. So you can also not be a mother, and many people are. So voluntary childlessness is where you choose not to have children. There are women who can't have children who want to, and we'll talk about them later. And then there's the motherhood mandate, and this is the social pressure on women to become mothers. And some of you may have already experienced this. I know as soon as I got married, everyone was asking me when we were going to have kids. And when I changed my Facebook status from engaged to married, all my ads changed from the acai diet to things about having kids. And that's when I put an ad blocker on my browser. So abortion is a really controversial issue in the US, but I think it's important to look at the stats related to it. So in terms of pregnancies in the US, as you can see, abortions are actually a fairly small proportion of them. There are people who have unintended pregnancies and continue them and choose to have the child. And there are intended pregnancies. They're about half. One thing that really surprises people is that a lot of people think that abortions are only women who have never had kids and they're being really irresponsible. 59% of US women obtaining abortions in the year 2014 were already moms. So these are women who are making choices, often very difficult choices, for their family to ensure that they have enough resources to provide for the children they already have. And one of the readings in the Land Handbook you'll do this week talks about how the animal kingdom does this. And some of it's disturbing, just to let you know, but it also sort of calls into question this idea of a natural maternal mothering instinct when we don't see it in any animal world. So common reasons for having abortion: desire to continue with education if you get pregnant during high school or college, for example. Not being able to afford having a baby. It's very expensive to have a baby. Not wanting to be a single mom. And having relationship problems. If you are having relationship problems, you may not want to bring a child into a place of strife. Now, in terms of the politics of abortion, most Americans have a pretty nuanced position. They're not, totally one way or the other, but we are sort of led to believe that everyone's either pro-choice or pro-life. So pro-choice is supportive of legal access to abortion, and pro-life is not supportive of that. And the people in both of those camps use different things for each other. So Pro-life people will call pro-choice people pro-abortion, and many pro-choice people argue, no, I'm not pro-abortion, I just want it to be an option should a woman need it. And then pro-choice people will often call pro-life people anti-choice. So again, a lot of animosity, and again, the vast majority of Americans really fall somewhere between these two. Now, when abortion was illegal in the US, many women died due to what are called back alley abortions. Essentially, you would pay someone under the table, and they would do all manner of things, maybe essentially use like a douche to put some chemicals up there, or they might literally use a wire hanger. And many women died as the result of this, as you can imagine. If you want sort of a classic portrayal of this, there's a great film starring Imelda Staunton called Vera Drake that talks about this. And there are other good examples of this as well in film and in stories. So the death toll, once abortion was made legal, is nearly zero. And this is really why most pro-choice advocates argue that it should be legal, that we are actually saving women's lives by so doing. Roe versus Wade in the 1970s was a Supreme Court case, and it legalized abortion in the US, but most states have passed significant restrictions on abortion. Globally, abortion rates are higher where it's illegal. So just sink that in. So when abortion's illegal, more people seek it. And that's likely because of decreased access to effective contraception in those countries. So one of the things pro-choice advocates have argued is, okay, you want to reduce the abortion rate, let's make birth control more freely accessible. An example of this is the state of Colorado, which actually made IUDs, the intrauterine device, free for a while. And so a lot of young women got them. This, if you remember from last module, is a long-term effective birth control method. And not only did their rate of unintended pregnancy go down, but also their rate of abortion went down. So something to ponder. Post-abortion syndrome is this term used by anti-abortion advocates, pro-life advocates, to describe a negative psychological reaction to abortion. Research hasn't supported that this is a thing at all. And one thing that's important to keep in mind is having an unplanned pregnancy is a significantly stressful life event. So whether you choose to terminate or maintain that pregnancy, it's stressful in and of itself. And being denied an abortion, research has shown, can increase anxiety, lower self-esteem, and lower life satisfaction. So there's a lot of stigma about abortion in our society. If you're from this area, the Hampton Roads, Coastal Virginia area, and you've ever driven by Planned Parenthood on Newtown Road, you'll know there are almost always some sort of protesters or prayer vigils there. Students have told me about how difficult it is just to go and get like their well woman check without being harassed, for example. So that leads to a lot of guilt, shame, and secrecy. And then that's where you get the unsafe practices, the isolation, and the clinical complications, including death, poor quality care, and you might end up having to have a higher cost procedure in order to actually like keep you alive. Infertility is something that's really important to talk about and that we really just don't talk that much about in the US. So this is the inability to become pregnant after 12 months of regular unprotected sexual intercourse. So again, this is very heterosexist, right? It just assumes that you are trying to get pregnant through normal means. And there's a lot of other things that go into play with this. Also, the definition changes once you're over 35 to 6 months. So there's that as well. Approximately 1 in 10 women, so about 10% of women, experience infertility, but only half of them will seek medical intervention. And one thing that's really important to note that a lot of people don't talk about is age affects fertility in both women and men. So people always talk about women's fertility or their biological clock ticking. It can also affect men. Women who experience infertility often experience stress, grief, anger, shame, and anxiety. And they may take on more roles as social mothers. So they become mother-like, they take on this motherhood role through social means like adopting, fostering, becoming a stepmother, or just serving that role to other people. In terms of treating infertility, we have many treatments that work in this day and age. One thing I will say is that a lot of these are not covered by insurance and end up being very, very expensive. So that's something to keep in mind. So you might be paying up to $20,000 or more out of pocket to do these. So not everyone could do it. Again, if we think about the imbalance we talked about at the beginning, we can see where this, again, is going to favor upper class people. So there's assisted reproductive technologies, which are called ARTs. This includes two that we're going to talk about actually just all three we're going to talk about here. So intrauterine insemination is a treatment where we have washed and concentrated sperm, and it's injected directly into the uterus at the time of the ovulation. It's more scientific than putting the sperm in a turkey baster and sticking it up there, as you've probably seen comically portrayed on shows like Jane the Virgin. But it's sort of the same principle. And then IVF, in vitro fertilization, is where you are given hormone treatments to ramp up your egg production. Eggs are extracted, an egg is fertilized with a sperm outside the body, and then one or more embryos are implanted after fertilization has taken place. And so this is, your eggs come out, typically your partners, although it can be, you know, someone else if your partner's not working, or if you don't have a partner or don't have a male partner, their sperm is combined and then they're inserted. One interesting thing about this is that there are higher rates of multiples because you often implant more than one embryo to hope for the best, right? So a lot more people with twins who go through this. And then surrogacy is a treatment for infertility where one woman is contracted to bear a child for another woman. And now another thing is there's lots of sort of in-betweens now too. So for example, you might be able to get donor eggs if your eggs are problematic, but still carry the baby yourself. Or some same-sex couples who are women, for example, might choose to have the egg from one woman implanted into the woman who will bear it. And then it's sort of like both parents are the mother. So reproductive tourism is a subset of what's called medical tourism. Dr. Kathy Stoley of Virginia Wesleyan actually does a lot of really interesting research and has a book written about this. So some individuals will go to other countries for fertility treatment, but most particularly for surrogacy because it's lower cost. So some people really argue this is exploitative because you've got women who are in sort of financial strain in other countries, being asked to do this for much less than they would in the US, but for what's a lot of money for them. But women who are hired to be surrogates see it as a personal choice, and that can provide significant income not otherwise available to them. So that's important to note as well. All right, so miscarriage and stillbirth are heartbreaking and much more common than we talk about in our society. So miscarriage is the experience of losing a pregnancy before the 20th week of gestation. So this occurs in 1 in 6 pregnancies, and I believe it's either 1 in 3 or 1 in 4 women who become pregnant at some point in their life will experience a miscarriage. So that's a lot. And again, we don't talk about it. This is something that's hidden and often seen as shameful. The medical world sort of plays into that by telling you not to tell anyone you're pregnant until after 12 weeks because your risk of miscarriage goes down then, sort of implying like you shouldn't tell people if you have a miscarriage, which can be obviously very isolating and difficult for those parents. It can lead to negative mental health as well as relationship problems, as you can imagine, especially if this ends up being coupled with something like infertility. And something that's important to point out is if you're going through something like in vitro fertilization, you can suffer a miscarriage even after paying all that money for it. And you can imagine the heartbreak, and you can end up with multiple miscarriages as you go through the process. Again, the heartbreak every time. And then there's stillbirth, and this is the death of a fetus after the 20th week of gestation. This is more rare, 1 in 100 pregnancies, but again, still probably much more common than we think about. And this can be shocking, devastating, lead to considerable grief. And why it's called a stillbirth is the majority of the time, the woman actually has to go through labor. So deliver a baby that is no longer alive. Now in terms of adoption, there are several different routes to adoption. So public, you can do a state agency. This often involves fostering. Typically, it's not newborns. Privates is where you do it via a private agency. This is often very pricey, and this is where you would get a newborn if you wanted to adopt a baby in particular. And independently do an adoption where it's set up by the families involved with the help of a lawyer. If you've seen the movie Juno, this is sort of that scenario. And then international is where it occurs across national borders. So this is sort of the Brad Pitt, Angelina Jolie, right? Where people joked about them collecting kids from around the world, but a lot of people do this. They'll adopt kids from Asia or Europe or Africa, areas where there are a lot of kids who need homes, for example. Birth mothers can experience negative mental health outcomes post-adoption, but typically if you have an open adoption where there can be some contact, this can be mitigated. Now, in terms of pregnancy itself, 85% of pregnant women will experience what's called morning sickness. This is an experience of nausea and vomiting during the first 12 weeks of pregnancy, and it doesn't always happen in the morning. It can be any time of day. So I had morning sickness when I was pregnant with my daughter, and there were times I threw up at like noon. And it doesn't matter what you eat. Like sometimes I would throw up just water after I drank it. Great, right? But the good thing is for the vast majority of women, it goes away. For those who don't, it might become a more serious medical condition to be treated. Kate Middleton, for example, had a version of that. Pregnancy can cause body image concerns in some women and trans men, but others experience pregnancy as freeing from the thin ideal. I actually took part in a study while I was pregnant, and it asked me questions about how do you feel about your stomach and things like that. And I was like, I feel fantastic. And even being the feminist I am, I don't know that I would normally answer that way, but it's a very different experience of your body. White, able-bodied, upper middle class women who are pregnant are generally treated with kindness and benevolent sexism. Poor, single, Black, and or teenage women who are pregnant are often very negatively stereotyped. So that's something else to be aware of. Childbirth, again, if you haven't experienced this or been close to someone who shared their experience, this is often surprising. Labor can take hours or even days, and sometimes you need medical interventions. Now, a lot of feminist work is really critical of medical interventions, but sometimes they are necessary, and I am a big advocate of them because I actually had to have an emergency C-section for both the health of myself and my baby. So I'm a big advocate of modern medicine. And so I don't have the same negative reaction that a lot of feminist writers and thinkers do. So one is induction, speeding up labor, and you might do this if the mother's health is at risk, for example. One is an epidural. This is anesthesia administered to the base of the spine with a needle. I actually ended up having to get an epidural because I had gestational diabetes and gestational hypertension. So my blood pressure went really high. And while I was sitting waiting for them to put in the epidural, I glanced over at the monitor and my blood pressure was 180 over 120. Like 120 is supposed to be your higher number. And I remember just thinking, I'm glad I'm getting this epidural because I don't want to die. So obviously, again, medical intervention can be really important and helpful. And it's just because pain increases your blood pressure. So it makes sense, right? An episiotomy, is a cut between the vagina and the anus to create a larger opening for delivery. Sometimes doctors will have to do that. If they don't do that, sometimes women will tear without it. So there's arguments that that can be easier to repair. And then the cesarean section is an abdominal surgery to deliver the baby. And if the epidural works for you, you could actually do this while you're awake. If not, you have to go under general anesthesia. But so I was actually awake during my C-section. And so they had like a curtain up so I couldn't see everything they were doing to my abdomen. But then when they pulled our daughter out, they actually dropped the curtain and there was a clear sheet we could see her through. So I got to sort of see her the moment she was born. So that was really cool. But then she got sort of taken away with my husband to get everything done she needed to get done, and I was on the table for another 45 minutes. So some people will argue, oh, the C-section is a cop-out. The C-section is the easy way to do it, but it's really not that easy for the mom, and it's a big recovery. It's at least 6-week recovery, for some women longer. And then in the US, infant and maternal mortality are significantly higher in Black women and infants. So this is really important. This is something that we're really just now starting to call upon the medical community to examine. And this is a really critical issue that's honestly horrifying that we need to think about. Oh, part of the problem is systemic racism. That is like the biggest part of this problem, right? We know that from other research that like the pain of Black women or just Black people in general tends to be ignored, women in general. So then you combine that, problematic. Also, the maternal fetal health initiatives in our country, I believe there are 7 of them and only 1 focuses on the mom. So that's another issue as well, that we also need to just focus more on maternal health in general. All right, so these are the Lamaze International Guidelines for a Healthy Birth. Lamaze is that stereotypical breathing. It's actually really effective for labor, but that you see in movies where they're like, it's not quite that, right? But they want you to let labor begin on its own, move around during labor to promote pain relief, bring a loved one or a doula for support. A doula is a trained paid professional. So I actually had a doula and my husband when I was giving birth. And a doula is basically a birth coach and they're your advocate. So it was really, really helpful to have her there. She helped me like decide that getting the epidural was the right thing for me to do and not feel guilty about it. And even did things like making sure my husband ate, which was really great and helped me push. I actually pushed for 3 hours before they figured out she had a knot in her umbilical cord, and that's why she wasn't moving anywhere. So having that extra support of a professional was well worth everything. Avoid interventions unless medically necessary. Try not to give birth on your back and push only when your body tells you it's ready. And then let the mother and baby experience immediate skin-to-skin contact. They call this the magic hour. So if you were to give birth vaginally, they immediately plop the baby on mom's chest, or they give it to dad if they can't do that right away. For me, it was when I was wheeled out of surgery, then I got to have her right away. That was really nice. Now, in terms of being a mother in this first part of it, there are a lot of postpartum mental health concerns. And some of these really just get brushed over. So the baby blues is something that a lot of women experience just with a hormonal crash after pregnancy. So the experience of crying, poor sleep, irritability, and anxiety after the birth of the baby. It's also just like being a new mom, to be honest, right? But postpartum depression and anxiety are a more severe version of that. So for postpartum depression, you have sadness, anxiety, exhaustion, guilt, and worthlessness. You can have suicidal ideation, and it's experienced after giving birth. And then postpartum anxiety, you have worry, sense of dread, obsessive checking, difficulty sleeping, and symptoms like panic attacks, like dizziness, nausea, and headaches. There's also a whole range of postpartum mood disorders, including postpartum psychosis, where you can actually like hear voices after you give birth. And one of the things that this doesn't mention that's actually really common postpartum is what's called intrusive thoughts, where you'll think of something horrible like, oh my God, my baby that can't move is going to like jump out of my arms and over this railing. And they're horrible and scary for the women involved, as you can imagine. There are a lot of great resources for women who are going through these things. And I've actually included the links for Postpartum Support Virginia, and it's a Postpartum Support International in the references for the extra material for this section. Now, in terms of gender roles after the birth of a kid, within relationships, they tend to become more traditional, although obviously modern families can work on that. Sometimes fathers are unwilling to do as much as mothers expect, although at least in my personal experience, I see that that's very different in sort of this generation, where fathers are a much more active part of things. And then maternal gatekeeping. Sometimes mothers will limit how involved fathers are allowed to be in caring for children. Again, I think that's really different in families that want equal parenting. Mother blaming is unfortunately really common within the profession of psychology, especially. So Freud comes to mind, right? Where everything was your mom's fault. And this is the idea that mothers should be held responsible for the actions, health, behaviors, and well-being of their children. Like, moms are partially responsible for that too, but so are dads, so are other members of the family, so is society as a whole. And this is more common towards mothers who don't conform to expectations. So if you're poor, a woman of color, single women, women who jugs when they're pregnant, but even women who choose not to parent in traditional ways, for example. Intensive parenting is the idea that parents, especially moms, are expected to be fully immersed in the parenting experience, get expert advice on how to parent, engage their children in these cognitively stimulating activities, and feel ultimately fulfilled in their role. And we know from years of research, we know from Betty Friedan's book, we know from all kinds of things that although this can be very fulfilling, it's not entirely fulfilling for all women. And so this expectation is really unrealistic. Now, feminist mothers today, many feminists work towards improving the structural and social support of mothers, particularly things like maternity leave, childcare access. But being a feminist mom is associated with endorsing what's called attachment parenting, which is a style of parenting where parents focus on meeting the children's needs on his or her own schedule, rather than trying to like schedule when naps are and things like that. And then feminist mothers want equality in co-parenting, although that can be hard to achieve, particularly, let's say, if you're breastfeeding. And then raising feminist children who challenge sexism. And I would say that all three of these are something that my husband and I have certainly done in raising our daughter. All right, so that's it for this mini lecture. And then I will go ahead and do the one for chapter 10 next. So I'll see you over there.